Good day. My name is Dr. Chikwendo Denze, the Acting Medical Director, University Health Services, Michael Okpara University of Agriculture, Umudike, and a family physician by profession and by specialty. Recently we've had cases of students, at least 2 students, who, in the course of playing football, they slumped and died. Though such an incident was very, very sad and it's happening as much as painful to the university community, that all of us felt it. But it will be pertinent to highlight one of the causes of this, why the students slumped and such a sudden death. Sudden death is an unexpected and instantaneous loss of life which will occur within minutes or hours, and which is devoid of any violence. About 75% of sudden death is caused by cardiac diseases. By that I mean there are so many of them: arrhythmias, coronary heart disease, myocardial infarction, heart attack. These are the things, so many of them, that cause sudden death. Somebody who is obese could easily have an embolus that could be thrown into the coronary artery. Coronary artery is one of the vessels that supply oxygen and blood to the heart for its function. So when there is any blockage within the coronary vessel, the heart will lack in oxygen and in blood. As a result, the pumping activity of the heart, which distributes blood to the brain, to other organs, will cease, and instantly that person can drop dead. The abuse of drugs, or what we call toxic sudden deaths, should be mentioned, and it is so very critical, because in an environment like this, you will see all manner of abuse of substances, ranging from tramadol, marijuana, skunk, and some other concoctions most the youth indulge in. This has led to a lot of them having some problems in their health, and based on this, there is the need for there to be health education on that. We have had incidences of students who were brought early as a result of this substance abuse, and we handled them. But we have also some of them who were not able to access the clinic or access the medical care early enough, and that led to a fatal effect, which was loss of the life of such a patient. So it's something that we should campaign very vigorously in our campuses and in other things, and people don't do that. Everybody knows in university health services, Michael Okpara University, before you are taken as a student and they start up to go into your main study, it's expected that you pass through the medical clinic for medical check, and which include an X-ray, at least chest X-ray and other laboratory tests. I can tell you categorically that in all these investigations we've done, we've used it to detect some people having one cardiac problem or the other. For instance, when you see an 18-year or 23-year-old student having an enlarged heart, it calls for concern that you want to investigate more to find out what was the cause. We have seen countless students within 18 to 23, 24 years with very high blood pressure in this university. All these things are things we've been doing, and when we see it, we immediately isolate such a student and start counseling and doing the needful and running some other investigations. That is what we've been doing for a long time, and it has helped to save a lot of these students. And not all of them, most times in their year one, come for this medical check. So another thing is, whenever any student or any staff detects or finds out that there is any changes in the system, such a student or such a staff is expected to report immediately to the medical center or to the medical team, so that further investigations could be done. So these are the means to mitigate against this sudden death here. And I want to say here that sudden death is not age related, as you can see in this instance. It can happen to a younger person, it can happen to an adult, it can happen to an older person. These people we lost last time, they were within their prime. They were not, I don't think they were up to their 30, in their 30s. These were people within their 20s, and we lost them. That is a pointer to tell everybody that there is no age that is exempted from going for medical check. Everybody is involved in all this. Thank you very much.